So you just booked your first physical therapy appointment and you're probably wondering, what should you expect? Whether you're injured, just had surgery, or if chronic or acute pain, all evaluations are gonna kind of be alike. So you'll come into the clinic, you'll be greeted by our front desk personnel. They're gonna ask you for any important documentation that you have, whether that be a script from the doctor, any imaging results, and also your insurance information, and then your driver's license as well. Once that is taken care of, then a physical therapist will come back and grab you from the waiting room. They'll bring you back into our evaluation area, and we're just gonna be sitting down with you and chatting about what's been going on. So the questions we're gonna ask you are just about the history of the injury, when it first started, what types of things you're having difficulty with, just so we can get a background of what's been going on and what your day-to-day looks like with when you're having the most pain, when your pain's better, just so we can get a good idea of the all-around injury that you've been having. After the question portion is complete of the evaluation, then we're gonna move into the assessment portion, where we're gonna be looking at how you're moving. We're gonna look at your range of motion, your strength, maybe your coordination, just so we can get a grasp of what's going on and what deficits you're having right now because of your injury. Then at the end of the evaluation, that's when we may give you a couple stretches or exercises to try at home before you come back in for your first follow-up session, where then we'll be able to take you through your personalized exercise protocol that we're gonna be helping you through. And then each visit after that, we're gonna be advancing those exercises to get you back to achieving the goals that you first came in with.